The National Conference for Nurse Practitioners is the conference for primary and acute care clinicians. NCNP will be held March 20th through 23rd, 2020 at the Gaylord Opryland Resort Hotel in Nashville, Tennessee. This biannual event is sponsored by Wolters Kluwer, publisher of the Nurse Practitioner, and offers you educational sessions relevant to advanced clinical practice, giving you the tools you need to improve the overall quality of patient care. To register for this event, visit us online at ncnpconference.com. We hope to see you in Nashville this spring. In this episode of the Nurse Practitioner Podcast, Deborah Adelman, Catherine Fant, Laura Wood, and Concetta L discuss disaster response. Isn't a disaster the same thing as an emergency?
I'm really glad that you asked that question because that is a common belief among non-disaster responders. So to explain the difference, an emergency is anything that someone who is prepared to respond in the field has to respond to. But when an emergency overwhelms the local response team, the EMS team, then it becomes a disaster. And there are times when, in actual fact, a disaster for a local area may not be for a larger entity. For example, you may have a disaster in your small town and call in the county to help you. And it's not a disaster for them. It's an emergency, but it's a disaster for you. But then it overwhelms the county and they call in the state. And then it becomes a disaster for you and the county, but not the state. So you can see that there's a bit of fluidity to how we define the term, but they are two very different entities.
In a small town, there's nothing to worry about with disasters or terrorist attacks, right?
I personally wish there were areas within the United States which did not have to worry about disasters or terrorist attacks. But unfortunately, this is not so. In regards to disasters, they happen everywhere. You can experience natural disasters such as hurricanes, tornadoes, earthquakes, to pandemics such as influenza in both small rural areas to your larger metropolis areas with higher populations. You can also experience man-made disasters in cities as well as small towns through examples such as fires or acts of terrorism. But small towns are unique to a terrorist attack for what it represents psychologically. Let's take Springfield, Illinois, for instance, known as the land of Lincoln, representing emancipation, freedom. For terrorism is not about the physical destruction, but the psychological effect of what they destroy. So no matter where you reside, small town or large metropolis, you need to be prepared for a disaster event. This will allow you to know how to help when a disaster strikes, have the emergency kit in place with strategies to support all members of your household, as well as your pet.
What happens in a disaster healthcare response?
That depends on how one enters the actual disaster. If you're a person walking down the street, a nurse practitioner walking down the street, and you see an explosion and you respond to it, you immediately provide health care. And as other responders arrive, your role will vary. If you work with a volunteer organization such as the Red Cross, you will be called out to the disaster response. You will be given an orientation as to what has happened and what is needed. And then you will participate as they ask you to participate. If you work with a DMAT, which is a disaster action medical team, you would be called out and given assigned roles based on your licensure and the needs in the area. What is important is that your skills are what are needed, and most times you won't be just jumping in without some preparation. You will be providing disaster care, triage, and that level of care. You will not be providing the type of care you'd give in an emergency room, a clinic, a hospital, or your office. You would not, for example, start CPR. If a patient has no respirations, no breathing, or a victim, you would reposition the head twice. If they don't start breathing spontaneously, you mark them as dead and go on, because the next victim down may have a bleeder that you can put some pressure on and save their life versus starting CPR and not being able to stop it. So understanding that disaster healthcare is a bit different does help you with responding.
What types of roles might an NP have in a disaster response?
Thank you for that question. As an NP myself, as well as an educator of NPs, I'm really excited to talk about how the NP is involved in disaster preparation as well as in disaster response. As a result of their advanced education and clinical skills, they're uniquely positioned for their involvement in all aspects, from preparedness to disaster recovery. Their role in community and acute care settings, as well as their expertise in collaboration, puts them in a very good position, as well as how the role has evolved in the past 4 to 5 decades. As you see now NPs working in acute care, you see them working in primary care, you see them working in extended care, psychiatric, intensive care, emergency rooms. So with the cornerstone of their practice focusing on holistic care of individuals, of families, of community, and health promotion and disease prevention. When you look at the NP's role, they're participating in emergency operation centers. They're participating on boards and disaster planning committees at the hospital level, at the state level, at the federal level. And when disaster strikes, they're caring for victims, and they're ready to work with patients, with the community, and they're ready to work in integrated health care teams as well as policy to improve the health care of all affected. During the disaster preparedness efforts, the NP provides information and education to the public as part of their everyday primary care practice or any practice they're in. They're implementing strategies to improve disaster care delivery by incorporating their knowledge of the relationship between healthcare issues and social determinants of health. Based on their scope of practice, the NPs will be able to work alongside of their medical colleagues, assessing victims physically, psychologically, looking at their status, looking at their chronic conditions, also atypical presentations that they may occur with exposure to toxic substances. They also may be focusing on making decisions regarding available resources for the victims. And as Deborah mentioned before, also regarding life and death interventions that may have to do, either start resuscitation or not. They also may be performing procedures, suturing, they may be casting, they may be splinting, they may be first assist or even performing minor surgery. Then during the post-disaster recovery phase, they are very well positioned in assessing and placing interventions for coping mechanisms and for adaptation of the individuals and the communities to the new environment, as well as continuity of care for their chronic and acute conditions.
Disaster nursing competencies are just NP competencies, right?
They are very close. The disaster nursing competencies want the nurse to be prepared to work with IT, to work with data, to work with communities, to work with their advanced practice skills. So there is a congruency between disaster competencies for all nurses and the NP competencies based on their education and training.
What happens with nursing and NP licenses in a disaster?
NPs provide healthcare services according to their scope of practice. In times of disasters, resources and qualified healthcare providers may be scarce. NPs responding to a disaster event may be called upon to perform services outside their normal scope of practice. The NP scope of practice will continue to evolve in a disaster based on adequacy of resources and availability of licensed personnel. For example, an NP may be called upon to perform surgery when there is no physician or surgeon available. Even a veterinarian may be called upon to provide care to humans when no one else is available. In Illinois, when a disaster is serious enough, the director of the Illinois Department of Public Health may request the governor to suspend licensing laws of healthcare professionals in order to expand the scope of practice of all healthcare professionals if needed. Therefore, it is important that you know how this works in your state or states of licensure. I would just like to reiterate the importance of knowing your state laws governing your response, the experience of those healthcare providers working alongside you during a disaster event, the adequacy of resources, all which will support your professional practice when responding to disaster events.
How do the responders communicate in a disaster?
I've included some thoughts as the NP considers the role of communication in a disaster or terrorist attack. The U.S. has recently experienced devastating hurricanes and fires, plus we all remember 9/11. Control over the disaster scene must be achieved as rapidly as possible in order for an effective response and to ensure the safety of the team members. To achieve this goal, accurate and timely communication among and between the team members and others is essential throughout the response to a disaster or terrorist event. However, this is complicated because of the variability in the expertise of the team members, responsibility, order in the hierarchy, the many different telecommunication tools, procedures, and terminology used by the teams. Additionally, telecommunication infrastructures and services are often the first severely impacted by disaster, including cell towers and the internet, thereby impacting the flow of information. Consequently, the restoration of communication is a critical priority. With all the advances in technology, there are more and more new information communication tools available to restore communication. However, cost is a significant issue because many of the relief and government organizations are unable to purchase these tools due to budgetary constraints. Fortunately, in many instances, responders still can rely on low-cost walkie-talkies. In view of the many issues impacting communication, it is essential the nurse practitioner participate fully in disaster training, such as offered by FEMA, so he or she can function effectively as a team member.
What happens when the disaster is over?
Many people think when a disaster is over, we all just go home and everything goes back to normal. But it doesn't really work that way. It doesn't even matter how you participated in the disaster, whether you walked up upon it or you were there as part of an official response or part of the Red Cross. When a disaster is over, one needs to go through debriefing and to understand that there are possible situations where you may experience PTSD and accept the fact that you may need to see someone for that. I wanted to bring this up because for me personally, I thought being a disaster nurse and having FEMA and Red Cross training made me immune from what happened after a disaster was over. And I learned after responding to 9/11 that that was not the case. I came home and people started telling me, you know, you can't just return to normal. You just can't come home that night and cook dinner for your family. And I was like, no, I understand. But I was having nightmares. I wasn't eating. I was very irritable. And I finally realized that I did need to see someone. And even years later, hearing a song that was played on the radio at that time could sometimes throw me back to that situation. So be ready when the disaster is over and you've participated in it to be part of a debriefing, to speak with others and to share your experiences so that you can start processing what happened.
How can I learn more about disaster response for NPs?
There are many avenues through which you can learn about this. It will start with learning about disaster response for nurses in general and then into the specialization. The American Red Cross chapter near you will offer disaster health care types of classes to help train you in that. They will give you an overview of what all the different teams do when they respond to mass care, health care, all those kinds of responses. There's also FEMA training. It is free. It is online, and there are some basic ones that you would need to take, like IS 100, IS 200, IS 800, and IS 700. But there are specific FEMA training that are for healthcare professionals, for nurses, and then for NPs. And I would just like to leave you with this. The way to learn more about disaster response for NPs is to read our series, where we will go into more depth on that.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.